As a benefits-eligible state of Texas employee and non-Medicare eligible retiree, you have the option of participating in the Texas Employees Group Benefits Program, GBP. The GBP offers many optional benefits in addition to health and prescription drug benefits. We'll give you a quick overview of those optional benefits in this presentation. We will start with dental benefits. ERS offers two dental plans: State of Texas Dental Choice Plan, Delta Care USA DHMO. You must be enrolled in a dental plan before enrolling eligible dependents, and everyone must be enrolled in the same plan. Each dental plan works differently, so make sure you're enrolled in the plan that works best for you and your dependents. The State of Texas Dental Choice Plan is a preferred provider organization dental insurance plan. You can see any dentist you want, but you will pay less if you go to a dentist in one of the two Delta Dental networks: Delta Dental PPO, Dental Premier. Dentists in both the Delta Dental PPO and Delta Premier are in-network providers. You still get the same coverage if you choose a Premier dentist, but you may pay more for a covered service because the dentist in that network can charge higher rates. You'll pay less for the same coverage if you choose a dentist in the Delta Dental PPO network. Benefits are available in the United States, Canada, and Mexico if you live in the United States. You're not required to designate a primary care dentist in the State of Texas Dental Choice PPO plan. You can see any dentist you like, but if you use an in-network provider, you pay less out of pocket than if you were to use a non-network provider. The maximum calendar year benefit is $2,000 per participant and includes orthodontic extractions. Once you've met that $2,000 calendar year maximum benefit for basic and major services, which excludes preventative services and orthodontia, the plan will pay 40% for in-network covered expenses, not out-of-network, for the remainder of the calendar year. You will be responsible for the remaining 60%. Delta Care USA is a dental health maintenance organization insurance plan. You can enroll in Delta Care USA DHMO if you live in the Texas service area. You'll need to select a primary care dentist on file with Delta Care USA from a list of approved providers. If you access services from a dentist who is not on the list of approved providers, the plan will not cover the cost. Before you enroll in Delta Care USA DHMO, make sure a dentist in the DHMO network is near your home. There is no deductible with this plan, but copays and coinsurance vary by service. The calendar year maximum is unlimited. You can find a more extensive chart on our website. Simply visit ers.texas.gov and find the summer enrollment link in the What's Happening Now section on the homepage. This will open up the Summer Enrollment 2023 page. Under the Plan Year 2024 Rates and Comparison Charts, you will find the Dental Plan Comparison Chart. The chart shows the difference between Delta Care USA DHMO and the State of Texas Dental Choice Plan. You can find information about your deductibles, copays, and coinsurance and the average cost of cleaning or an oral exam. For more information about each dental plan, you can visit ersdentalplans.com and click on the plan you are interested in. You will find a plan overview and detailed information about your dental benefits. And if you'd like to contact the plans directly, you can always call them toll-free at 888-818-7925 TTY711. You can also email ersdentalinfo@delta.org if you have a question about the plan. The group numbers for each plan are State of Texas Dental Choice PPO, group number 20010, Delta Care USA DHMO, group number 79140. You also have the option to enroll in vision benefits. As of September 1st, 2023, the new plan administrator is IMED. State of Texas Vision is available to employees and retirees and their eligible dependents. You must be enrolled in the plan in order to enroll your eligible dependents. The plan includes a $15 copay for a routine eye exam when using an in-network or contracted provider. There is a $200 retail allowance towards frames or contacts depending on your preference when using an in-network provider. Additional plan benefits include contact lens exams and standard single vision lenses are covered when using an in-network provider based on a copay. iMed has a large nationwide network with some participating retailers, including Lens Crafters, Pearl Vision, Target Optical, Texas State Optical, Walmart Vision Center, Sam's Club Optical, America's Best. Online retailers include ContactDirects.com, Glasses.com, and Rayban.com. You can find a vision plan comparison chart on the ERS website. Simply visit ers.texas.gov and find the summer enrollment page link in the What's Happening Now section on the home page. It will direct you to the Summer Enrollment 2023 page. From here, you can click on the Vision Comparison Chart under Plan Year 2024 Rates and Comparison Charts. The chart shows what the member will pay when accessing in-network and out-of-network services. When you access vision services, you want to be aware of the correct copays, so it would be helpful to take this chart or have access to it. After September 1st, for more information about the State of Texas Vision Plan, you can visit stateoftexasvision.com. There you will find a plan overview with more details about what the plan covers. You can also call iMed toll-free at 844-949-2170 if you have a question about the plan. The group number for State of Texas Vision is 1050072. If you are not already enrolled in life insurance, you may want to consider applying for life insurance and/or dependent term life insurance. Optional term life insurance options are different for employees and retirees. If you're an active employee, you may choose coverage from 1 to 4 times your annual salary up to $400,000. Election 1, the coverage amount is equal to your annual salary. Election 2, 2 times your annual salary. Election 3, 3 times your annual salary. Or Election 4, 4 times your annual salary. The monthly premium is based on your coverage election, your salary, and your age. If you didn't enroll in optional term life during your first 31 days of employment, or you currently have election 1 or 2 and want to enroll in elections 3 or 4, you will need to initiate the evidence of insurability process online and complete the EOI application. We'll talk more about the EOI process in just a moment. If you're a retiree currently enrolled in optional term life insurance, your coverage level will be 1 or 2 times your last reported annual employee salary, and you don't have the option to increase your current coverage level. You can decrease your current coverage level, change to retiree fixed optional life insurance, or waive your optional term life insurance at any time, even outside your annual enrollment period. Retirees not currently enrolled in optional term life insurance can apply for the retiree $10,000 fixed optional life insurance through the EOI process. This benefit isn't available to active employees. Dependent term life insurance is an option available for both employees and retirees. Employees can enroll eligible dependents for one set premium per month, regardless of how many dependents are covered. Coverage includes $5,000 per covered dependent, which is paid to you upon the death of your covered dependents. A $5,000 AD&D benefit is also included with the $5,000 dependent term life coverage. Retirees can enroll eligible dependents for one set premium per month, regardless on how many dependents are covered. Coverage includes $2,500 per covered dependent, which is paid to you upon the death of your covered dependents. There is no AD&D clause for retiree dependent term life insurance. EOI is required and must be approved for this coverage. If you have dependents already enrolled in this coverage, you don't have to submit EOI. Their coverage would continue into the new plan year. Another option you have is voluntary AD&D insurance. This coverage provides additional protection for you and your family in the event of accidental death or certain accidental injuries. You can elect in increments of $5,000 with benefits between $10,000 and $200,000. This is in addition to the $5,000 AD&D benefits provided with basic and optional term life insurance for active employees. There are two coverage levels, you only or you and family. Only active employees can enroll in this plan. EOI is not required to enroll in this coverage. Have you gotten married or divorced since the last time you updated your beneficiaries? Have you had other family status changes since that time, like adopting or having a child? If so, don't forget to reevaluate your beneficiaries. If you need to change beneficiaries or update your current beneficiaries' information, you can do this at any time during the year. Summer enrollment isn't the only opportunity. It's important that you complete the process when designating or updating beneficiaries. You will receive an authorization form by email if you have one on file, or by mail if you don't have an email address on file. You must sign the form and send it back to ERS. Be sure to follow the instructions on the form. For more information about the life insurance plan, you can visit web1.lifebenefits.com/sites/lbwm/ERS. There you will find a plan overview with more details about what the plan covers. You can also call Securian Financial toll-free at 877-494-1716, TTY 711, if you have a question about the plan. Disability benefits is available only to active employees, not retirees. This year, the rate for short-term disability is slightly decreasing. You can check your PBS for the new rate beginning September the 1st. Did you know that according to the Texas State Government Effectiveness and Efficiency Report, almost one-third of U.S. workers become disabled for at least 3 months in their lifetime? Many U.S. workers don't have enough savings to cover 3 months of living expenses. It's important to be prepared for these unforeseen circumstances. So, consider enrolling in disability insurance through the Texas Income Protection Plan. There are two plans available through TIP: short-term disability and long-term disability. Short-term disability covers up to 66% of your monthly salary, capped at $6,600 per month for individuals making more than $10,000 monthly for up to 5 months. Remember, you must use all available sick leave, including extended sick leave pool, and/or donated sick leave, or complete the 30-day waiting period, whichever is longer, before the benefit will be paid. Long-term disability covers up to 60% of your monthly salary, capped at $6,000 per month for individuals making more than $10,000 monthly, for a period ranging from 12 months to full Social Security retirement age, depending on how old you are at the time of disability. Remember, you must use all available sick leave, including extended sick leave pool, and/or donated sick leave, or complete the 100-day waiting period, whichever is longer, before the benefit will be paid. Evidence of insurability is not required if you enroll within your first 31 days of employment. After your first 31 days of employment, you can apply through EOI if you have a qualifying life event such as a birth or marriage or during summer enrollment. Please note, pre-existing conditions are subject to certain exclusions. There is a 6-month pre-existing clause. If you've gone to the doctor or you've received treatment for a medical condition during the 3-month period prior to the date coverage begins, disability benefits for that specific condition will not be covered for the first 6 months. For more information about the Texas Income Protection Plan, you can visit regroup.com. There you will find a plan overview with more details about what the plan covers. You can also call TIP toll-free at 855-604-6230, TTY 711, if you have questions about the plan. We briefly talked about evidence of insurability, or EOI, when discussing electing life insurance and disability benefits. Let's talk a little bit more about who to contact if you have to go through the process. If you are electing more life insurance benefits, you must elect the EOI process through Securian, the program administrator. The evidence of insurability application will be sent to you from Securian, and if you have any questions, you will need to speak with them. If electing disability benefits, you will complete the EOI process through Guardian Life Insurance, the underwriter for TIP. You can contact Read Group to get your questions answered about the EOI process. It's important to know that EOI must be initiated online during summer enrollment by the deadline of July 28th. If the EOI approval is dated before September 1st, coverage begins September 1st. If EOI approval is dated on or after September 1st, coverage begins the first of the month following EOI approval after ERS receives the notification. For example, if ERS receives notification of EOI approval on October 15th, your coverage will be effective November 1st. Active state employees have the option to enroll in the flexible spending accounts. This benefit is not available for retirees. ERS offers TaxFlex, which is a tax savings program regulated by the IRS and available to active employees. It lets you set aside money from your paycheck before taxes to use towards eligible out-of-pocket expenses, so you save money on taxes. We offer a healthcare FSA, limited purpose FSA, and a dependent care FSA. Enrolling in the healthcare FSA allows you and your dependents to use the funds towards eligible expenses such as medical, dental, vision, and prescription drugs. You can elect to contribute a minimum of $180 up to $3,050 annually. Your contributions are deducted pre-tax from your monthly paycheck. Your entire contribution is available your first day in the program, even though you haven't contributed all of the funds in your account. Next, if you decide to enroll in Consumer Directed Health Select, you can use your HSA to pay for eligible medical expenses, so you won't be eligible to enroll in the Healthcare FSA. However, you do have the option to enroll in the Limited Purpose FSA. The Limited Purpose FSA works exactly the same as the Healthcare FSA, but you can only use the funds towards eligible dental and vision expenses. Remember, the Limited Purpose FSA is only available to Consumer Directed Health Select participants. The carryover amount for healthcare and limited purpose FSAs is increasing. If you have a healthcare or limited purpose FSA in plan year 2024, you can carry over up to $610 from plan year 2024, ending August 31st, 2024, to plan year 2025, starting September 1st, 2025. There are 3 ways to claim money. First, pay for expenses using the TaxFlex debit card at the time of purchase. Second, pay out of pocket at the provider and upload claims through the TaxFlex website or mobile app after incurring the expense. Third, pay out of pocket at the provider and submit a claim by fax or mail after incurring the expense. Remember to save all receipts. Even when using the debit card, the purchase may not be automatically verified as an eligible expense. PayFlex is required by the IRS to validate every purchase as an eligible expense. If they are unable to verify the purchase, they will ask you to provide a receipt to confirm the purchase was eligible. Finally, let's look at the Dependent Care FSA. You can enroll and submit eligible dependent care, includes children and adult, claims for reimbursement. You can elect to contribute a minimum of $180 up to $5,000 annually per household into the account. Your entire contribution amount is not available up front. Much like a checking account, the money must be in the account before you use it. The Dependent Care FSA is a reimbursement program. The cost of services has to be incurred and the services received before a claim can be filed. If a claim is filed prior to receipt of services, the claim will be denied and need to be resubmitted. Reimbursements can only be received up to the amount available in the account. Once money is available in the account again, you will be reimbursed for any remaining amount of a claim. There is no carryover for a Dependent Care FSA. However, available funds not used by the end of the plan year, August 31st, can be used during the grace period from September 1st through November 15th. December 31st is the last day to submit claims incurred through the end of the grace period. Funds not used by November 15th will be forfeited. There are two ways to claim money. First, upload claims through the TextFlex website or mobile app after incurring the expense. Second, submit a claim form by fax or mail after incurring the expense. For more information about the TextFlex program, you can visit textflexers.com. There you will find a plan overview with more details about what the plan covers. You can also call TextFlex toll-free at 866-353-9839, TTY 711, if you have a question about the plan. As an active state employee, you can enroll or disenroll in the Texas Saver benefits at any time. As a retiree, your contributions stop upon retirement, but you still have access to the funds in your account. As an active employee, you can boost your retirement savings through the Texas Saver 401k 457 program, a voluntary retirement savings program administered by Empower Retirement. Because it's so important to save for retirement, new employees are automatically enrolled in the Texas Saver 401k plan. 1% of your salary is set aside pre-tax in the savings account. You can increase, decrease, or stop your contribution at any time and change how your funds are invested. You can transfer money from a qualified retirement account from a previous employer to maximize your savings with Texas Saver. Please note, program availability may differ for some higher education institutions. If you are a retiree, you no longer make contributions into your Texas Saver account. Once you retire, you want to reach out to Texas Saver to get information on what happens with your account balance. To learn more about managing your Texas Saver account, you can view one of the presentations available through the Texas Saver website or contact Empower directly at 1-800-634-5091. For more information about the Texas Saver program, you can visit www.texassaver.com. There you will find plan resources and an overview of the different plans with more details about what each plan covers. You can also call Empower Retirement toll-free at 888-634-5091, TTY 711, or you can email at texassaver@empower-retirement.com if you have any questions about the plan. On the next slides, we will show you some resources available to you anytime. You can find links to each plan administrator on our homepage in the Benefits Program section. It is located in the center of our website and lists all of the programs in the Texas Employees Group Benefits Plan. This includes health insurance, prescription drug coverage, life insurance, dental and vision coverage, retirement, and even our discount purchase program. Remember, if you need to make changes to your coverage, consider logging into your ERS account and make your benefit election changes online. It's the quickest and easiest way, and a confirmation of your requested changes will be sent via email if your email address is on file. Otherwise, the confirmation is mailed to you. If you are applying for a benefit that requires EOI, remember the EOI must be initiated online. Click on the My Account Login button. Once you are logged in, you can make your benefit elections online, certify your tobacco user status, update your contact information, and update your beneficiaries. For more videos about your benefits, check out our ERS YouTube page. Thanks for watching.